Sagittal section of male pelvis. Male urethra has three parts: prostate urethra, membranous urethra, penile urethra or spongy urethra. Prostate urethra 4 cm passing through prostate. Membranous urethra 2.5 cm passing through deep perineal pouch. Penile urethra or spongy urethra 15 cm passes through penis. Prostate urethra, anterior lobe, minimal pathology. Medial lobe, prone to BPH, benign prostatic hyperplasia. Posterior lobe, prone to cancer. Uvula vesicae, urinary retention due to medial lobe hypertrophy, known as BPH, where a tongue-like projection goes into urinary bladder, known as uvula vesicae. Then TURP, transurethral resection of prostate, have to compromise internal urethral sphincter called sphincter vesicae, causes retrograde ejaculation of semen into urinary bladder, seen in greater than 90% cases post-TURP. Zones of prostate: periurethral zone or transitional zone, prone to benign prostatic hypertrophy leading to bladder outlet obstruction. Peripheral zone, prone to cancer. Anterior muscular zone, fibromuscular stroma, has no pathology. Central zone, presenting with minimal pathology. Parts of male urethra. Male urethra, length 20 cm. Male urethra consists of three parts: prostatic, membranous, spongy. Prostate urethra 4 cm. Membranous urethra 2.5 cm. Penile urethra or spongy urethra 15 cm. Male urethra lined by stratified columnar epithelium, except proximal half of prostate urethra, transitional epithelium. Tip of male urethra, non-keratinized stratified squamous epithelium. Narrowest lumen of male urethra, external urethral meatus greater than membranous urethra. Widest urethra, bulbous urethra greater than prostatic urethra. Least dilatable, membranous urethra. Most dilatable, prostatic urethra. In transverse section, prostatic urethra appears as crescent shaped. Female in lithotomy position, from inferior to superior. Skin, collis fascia, then superficial perineal pouch. Superficial perineal pouch has bulbospongiosus, ischiocavernosus, superficial transverse perineal muscle, then perineal membrane, then deep perineal pouch. Deep transverse perineal muscle and external urethral sphincter in deep perineal pouch makes urogenital diaphragm. Levator ani muscle, making pelvic diaphragm, pelvic viscera. Central tendon, perineal body, receives insertion from muscles of superficial perineal pouch, deep perineal pouch, fibers of levator ani muscle. Ischiocavernosus muscle, lateral muscle, does not insert into perineal body. Ischiorectal fossa. One ischiorectal fossa communicates with another fossa through horseshoe-shaped communication passing behind anal canal. So, abscess in one fossa can communicate with another fossa. Boundary: medial levator ani muscle, lateral obturator internus muscle inserted on the ischium part of hip bone. Anterior perineal membrane, superficial transverse perineal muscle. Posterior gluteus maximus, sacrotuberous ligament. Content: inferior rectal artery, inferior rectal nerve, inferior rectal vein, fibrofatty tissues. Contents of ischiorectal fossa is inferior rectal artery, inferior rectal nerve, inferior rectal vein, fibrofatty tissues. Some important information: pudendal canal has pudendal nerve and pudendal vessel, giving branches to inferior rectum and anal canal. Inferior rectal nerve branch of pudendal nerve carry pain of external anal canal. External hemorrhoids. Female urogenital diaphragm. Anterior pubic vein. Posterior sacrum and coccyx. Lateral ischium bone, ilium. Pelvic diaphragm has three parts: pubococcygeus muscle, levator ani muscle, iliococcygeus muscle, levator ani muscle. Ischiococcygous muscle, not part of levator ani muscle. Sphincter of three opening in female perineum. Sphincters of three opening in female perineum. Pubourethralis, around urethra. Pubovaginalis, around vagina. Puborectalis, around rectum. All the above three are components of pubococcygeus muscle. Sagittal section of female pelvis. Abdominal wall is covered by parietal peritoneum, continues as visceral peritoneum, covers fundus of urinary bladder, uterus, upper part of rectum, and goes to posterior abdominal wall as parietal peritoneum. Lower border of bladder, urethra, vagina, lower rectum, not covered by peritoneum. They are subperitoneal.